Hello and welcome to another Healthy Bite. My name is Dr. Ron Ehrlich. Now, if you haven't had a chance to listen to the episode I did with Belinda Fettke, a medical researcher, the wife of Dr. Gary Fettke, who is an orthopedic surgeon in Tasmania with a very interesting story, and we've released that podcast to coincide with Belinda. Gary was one of the very first podcast episodes I did on the Unstressed with Dr. Ron podcast series, going back now 3 years. And I did it with him for a very good reason, and that reason was about public health messages, about the demonization of anybody that challenges the status quo, and basically the whole story behind confusing and contradictory public health messages, which is something that I've explored in my book. In the first part of my book, I cover this in a lot more detail, and if you listen to the Belinda Fettke episode, you will realise that she has covered it in even more detail than that. So it's a story that's a really important one because public health messages are confusing and they are often contradictory. And we're experiencing that now with the pandemic, which I'm going to cover in later podcasts in another Healthy Bite. But basically, in this episode, I thought I would just touch on some of the issues that make those public health messages so confusing. Because whenever we hear about nutritional advice, for example, we're always confronted with images. If you're watching this on YouTube, which I'd recommend you do, but if you're listening to it, I'll explain it to you as I go. We're often confronted by images of hamburgers, chips, processed foods, and that is what poor nutrition is often described as, and it most certainly is poor nutrition. I'm not saying it's not, but I would argue that possibly one of the most significant nutritional stresses we have faced has come in the form of a public health message, and that is the food pyramid, which was kind of being formulated in the late 1970s and early 80s and eventually found its way into the FDA. The Food and Drug Administration approved it in 1992, and it basically put breads, cereals, rice and pasta groups as the foundation for a healthy diet. You should have 6 to 11 servings of these a day, and of course the whole demonization of fat, and in particular animal fats, was part of that. Now that was 1992, and in 2011 it morphed into My Plate. And what goes on in America goes on in Australia as well, and it morphed in 2013 into what became known as the Australian Healthy Eating Guidelines. Now, I mentioned in the podcast with Belinda, and I've mentioned it before, that I've been following this story right through my professional career, or from very early on for example, when I was grappling with the issue of mercury amalgam in fillings, and I'd been taught at university that it was locked in, that it was perfectly safe, that there was no problem with it. But certain chiropractors and naturopaths drew to my attention that perhaps the advice that I was getting from the universities and the professional organisations I was a member of may not have been as accurate as they could or should have been. And in fact, mercury was being released from the fillings. And now, although it is illegal to put dental mercury amalgam scraps in the garbage or toilet or down the sink, even in 2021, it is apparently the only safe place to keep dental mercury amalgam, according to the NHMRC, the Australian Dental Association, and the dental boards and the universities. The only safe place to keep this mercury product, which releases mercury, is in a human being. Now, that's the whole subject for another thing, but that's what got me started in the mid-80s on my journey of asking some questions about public health advice, and that's still to this very day. And nutrition has been my interest since the early 80s, so nutritional advice is always something of interest to me. So I would say this food pyramid and the Australian Healthy Eating Guidelines are a problem, but the question is, how are they formulated? And that led me to reading books like this, The Death by Food Pyramid by Denise Minger. If you haven't read it, I would recommend it to you. It came out in 2013. How Shoddy Science and Sketchy Politics and Shady Interests Have Ruined Our Health, and How to Reclaim It, which is something that I cover in my book and what this podcast is all about. It was by no means the only book on this topic when it came to nutritional advice. There was also Gary Taubes, who is a science journalist, wrote some excellent books, Why We Get Fat in 2010 and The Case Against Sugar in 2016. Now, Belinda references the work of another author, David Gillespie, who dealt with his own health issues, and I did a podcast with him. I'd recommend you go back and listen to it. In 2008, he wrote a book called Sweet Poison, Why Sugar Makes Us Fat, and Big Fat Lies, how the diet industry is making you sick, fat and poor, 2012. Look, these are all things which challenge the food pyramid and the low-fat dogma. And in case you're wondering what effect, because we hear so often about everything must be evidence-based, and I think that's a good point. We should be. So why don't we look at the evidence? And when we look at the evidence and we see the trajectory of diabetes, for example, or if we go back even further and look at the trajectory of obesity, we note, and this graph that I'm showing, but let me describe it to you, that at the time that the dietary guidelines for Americans, which was the precursor, which was the food pyramid, was first introduced in about 1980. Remember, it didn't get FDA approval until 1992, but in 1980, at the late 70s, in 1980, it was introduced, and from that moment on, obesity started to go through the roof in the US and in Australia. But if we fast forward to look at diabetics as well, the same thing has happened. Ever since the FDA and the Heart Foundation and American Diabetes Association approved and endorsed the food pyramid, diabetes has gone through the roof. The advice hasn't changed, the evidence hasn't been followed, and the question is why? And the answer comes back to how are these public health messages formulated? And it was so interesting to me because in 2014 I attended the Australian and New Zealand Obesity Society's annual scientific meeting, and you know, obesity is everyone's challenge. And when I looked at the delegate handbook, one of the sponsors was the Sugar Research Advisory Service, providing, and I'm quoting here, providing the scientific facts on sugar and health from Australian and New Zealand experts. Are you confused about sugar, they asked? Tackling the toxic is sugar health messages. Is sugar really the culprit of the obesity epidemic? And the Sugar Research Advisory Service sponsored the Obesity Society's meeting, and one can only imagine what effect that has. Well, let me share with you some other little pearls, because when you ask how are public health messages formulated, you would think the Dietitians Association of America would be a good place to start, right? And the Academy of Nutrition and Dietetics, the world's largest organization of food and nutritional professionals, which was formerly referred to as the American Dietetic Association, when I saw this, I was concerned because in 2008, 2007, the American Dietetics Association welcomed Pepsi Cola as a major sponsor, 2007. Of course, if they had Pepsi Cola in 2008, it didn't come as a great surprise that they also welcomed the Coca-Cola Company as a major partner who are helping formulate the world's greatest organization on nutrition advice. So there is that. And when I actually went even further and looked at the world's largest organization of food and nutritional professionals, as I said, formerly the American Dietetics Association, here is a list of their sponsors. Their partners, that is helping them formulate educational programs, are Aramark. I'm not quite sure who Aramark are, but anyway, the Coca-Cola Company, Hershey, you may know about Hershey chocolate bars, and the National Dairy Council. So they were their major partners, and the premier sponsors were Abbott Nutrition, that does a lot of baby formulations, General Mills, which is a cereal company, Kellogg's, of course, Mars bars. They're a very important partner for this American Dietetics Association. Pepsi Cola, I'd already mentioned. Soyjoy, the makers and producers of soybean products. Truvia, natural sweetener, and Unilever, the makers of Flora margarine and Ben & Jerry's ice cream. The other event sponsors included ConAgra, Safeway and Target and Campbell's Soup Company, plus a few others. And they are the sponsors of this organisation. Now, interestingly, there's another very august organisation, or the American Society for Nutrition, whose byline is Excellence in Nutritional Research and Practice. This was established in 1928, and it's dedicated, I'm quoting from their website here, it's dedicated to bringing together the world's top researchers, clinical nutritionalists, and, importantly, industry to advance our knowledge and application of nutrition for the sake of humans and animals. Very noble group there. But a list of their sponsors, the American Society of Nutrition is pleased to acknowledge the support of these organisations for educational programs of the society. So these are the companies that are helping the American Society of Nutrition formulate educational programs and help sponsor public health messages. And who might they be? Well, I won't go through the whole list, but if you're watching this, you can look at it. But I'll read out some of the highlights. Abbott Laboratories, one of the biggest pharmaceutical companies in the world. Campbell's Soup. Cadbury's Schweppes. The Coca-Cola Company makes another appearance, as does ConAgra Foods. The Dannon Company, which does a lot of yogurts and dairy products. DSM Nutritional Products. Eli Lilly, which is a drug company. Gerber Products Company, you remember Gerber Baby Foods. GlaxoSmithKline, a drug company. And interestingly, with GlaxoSmithKline, it's interesting to see them supporting the food industry here, but they were also a pharmaceutical, and they hold the award for the biggest legal fine for illegal marketing of their products. They were fined in about 2010, I think, $3 billion. I digress, but here they are supporting the food company. Kellogg's Company, again, of course, Kraft Foods and Mars Bar, again, make their appearance. You'll be reassured to know Monsanto are a major sponsor, as of course are the National Dairy Council. So any suggestion that dairy food may have any problem at all, we must dismiss that. Nestle Nutrition, of course, Pepsi Cola making another appearance here. Pharmanex, a drug company. The Procter & Gamble Company, of course. Sara Lee Foods, Sara Lee Cheesecakes. I actually do like Sara Lee cheesecakes, but I've never pretended they're good for me. The Sugar Association, Unilever, again, the makers of Ben & Jerry's ice cream and Flora. Wrigley, the chewing gum people, and Wyeth, both nutritional and consumer healthcare. So there's just a list of some, and in case you're wondering, what is the big deal? So what's the big deal, Ron? Come on, get over it. I mean, what effect do these kind of sponsorships have on these professional organisations? So I want to give you a very simple example. The American Academy of Pediatric Dentistry. Now, they are an academy that specialises in children's oral health. The American Academy of Dentistry in 2003 said something that even anybody with the most basic knowledge of nutrition could not argue with. And that is this: frequent consumption of sugars in any beverage can be a significant factor in the child or adolescent diet that contributes to the initiation and progression of dental caries. In other words, sugary drinks cause tooth decay in children, adolescents, and for that matter in adults. And that was their clear public health message in 2003. Then, in 2004, PepsiCo, who, as you know, sponsored all those other organisations, sponsored the American Academy of Pediatric Dentistry. And in 2004, they subtly changed their message from saying sugary drinks cause tooth decay to this: scientific evidence is certainly not clear on the exact role that soft drinks play in terms of children's oral disease. So let's translate that to public health messages. And I think you get an idea of why Belinda Fettke and myself have been interested in this for some time, and we're not the only ones. Professor Marion Nestle, no relation I think to Nestle ironically, wrote this book in 2002, Food Politics, How the Food Industry Influenced Nutrition and Health. Marion Nestle is a world-renowned professor of public health. And then we come to the 2013 Australian Dietary Guidelines. Now, I did a podcast with James Mookie. James Mookie was the Australian of the Year in 2020. He's an ophthalmic surgeon who has done some amazing humanitarian work in Southeast Asia, and he was named Australian of the Year in the beginning of 2020. And he decided, because he had seen the devastation that type 2 diabetes causes to blindness, it not only causes gangrene of uncontrolled diabetes, will eventually result in gangrenous limbs, resulting in amputations, which is why orthopedic surgeon Gary Fettke was feeling so passionate about this. Here we had Australian of the Year ophthalmic surgeon James Mookie deciding to champion type 2 diabetes. And when he started to look at the Australian Healthy Eating Guidelines, he, like so many other health practitioners, in fact, so many of your health practitioners, the doctors that you go to visit and who see you with the best of intentions. I mean, doctors just follow, they're so busy in their practices, unless they have made nutritional and environmental medicine an issue, which I believe they should, but a lot of doctors don't necessarily prioritise it. And I covered that with my discussion with Professor Ian Brighthope in another podcast. But like tens of thousands of health practitioners, they just accepted the Australian Healthy Eating Guidelines, and so did Australian of the Year James Mookie, until he became Australian of the Year and then started to explore diabetes and how he would frame public health messages. And he was shocked to learn of how the Australian Healthy Eating Guidelines are formulated. As I have said many times on my podcast, this is a story that is easy to miss as a busy health practitioner, but once you hear it, very difficult to ignore. And it was very difficult for James Mookie to ignore it. It was very difficult for Gary Fettke to ignore, and it launched Belinda Fettke and Gary on a journey of exploration about how public health messages are formulated, and that's why I have put it in as the first part of my book, and why I still continue to explore it. And if you want to explore it, I would recommend that you go onto YouTube and listen to a short 18-minute presentation. I'll have the links to it in this show notes, but Dr. Mary Ann Damasi, who many of you may know as the host of the ABC's Catalyst program, she has a PhD, she's a medical practitioner, has a PhD, and also is a medical researcher, and she explores who really influences nutritional policy in Australia. So I'll give you a hint as to what is involved in the Australian Healthy Eating Guidelines. The NHMRC put it out to tender every 10 years, and the tender is worth $500,000. And the Australian Dietitians Association won the tender in 2010, and then it was eventually released in 2013. I'm not going to spoil it for you, other than to say the sponsors of the Australian Dietitians Association are this: the Grains and Legumes Council of Australia, Kellogg's, Campbell's, Arnott's, Unilever, the makers of Ben & Jerry ice cream and Flora margarine, Nestle, Dairy Industry of Australia, Abbott Nutrition, the makers of Glucerna, new shakes and bars designed for people with diabetes to use as part of a weight loss plan, and Nutricia Australia, advanced medical nutrition, part of the Danone Group, which you have heard from the American Dietitians Association. So I would really recommend you look at that YouTube clip because it's well worth watching. Look, this is the point. And the point is, as I have also made many times, that public health messages are formulated largely by the chemical, food and pharmaceutical industry, who sponsor professional organisations who wittingly or unwittingly act as proxies for the commercial interests of those organisations. And it is a beautiful economic model. There's only one problem, if the evidence is anything to go by, and that is that it's not a very good health model, because heart disease is still the number one killer. Cancer is number two. Number three killer actually is prescription medications, but then that's also followed by autoimmune conditions, of which there are over 100, and then diabetes. And these are preventable problems. With good public health messages, these issues could be prevented. But with this kind of corporate influence, it's a very uphill battle. And that's why that's what this podcast is about. That's what my book is all about. That's what Belinda Fettke's work is all about. And it's about finding reliable information. And I struggle with this myself. As aware as I am of it, I struggle with it myself, and that's what I do, and that's what I'm trying to impart to you. And I'm doing that throughout this entire pandemic, trying to promote immune function, because I believe what we should be doing is getting the best of everything, the best that pharmaceutical products have to offer, and they have an important role to play in our healthcare. I'm not anti-pharmaceutical. I'm just wanting to also take the best of what complementary, functional, integrative medicine has to offer as well, and come up with what is best for public health. Look, that's something obviously I've felt passionate about for a long time, and that's what this podcast and my health programs are all about. Thank you for listening. I hope this finds you well. We'll have links to some of the things I've mentioned, and if you want to have a look at this on YouTube, you will see some of the visuals that go with it, but I think it's worked okay as an audio file as well. Hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences and conclusions.